Okay, Mark, let's talk archwires. I typically have used a speed tubular super cable, which you get from Speed System. I'm going to send two with you. As you can see, they are normal arch shape. They are so light and flimsy, you're not going to distort your arch shape. You can really take these and bend them like crazy, which you can maybe kind of see, but my fingers are in the way. Let's try that again. See how much those can be bent? Okay, and then when you release, just like nitinol, they'll go back to their normal shape. These wires are really good, but they're twisted, braided wires, and because they're has a hollow tube on the inside, you're going to need to crimp some split stops. I'm also going to send some of the stops with you. In addition to putting the stops on, you need a very sharp cutter to cut that wire so it doesn't fray. And what I've been doing lately is trying to put a stop on, and then I'll put a drop of composite over top of the stop because they do tend to fray. And I had an emergency this morning, and that's exactly what happened. And I had to come over to the office and fix her. You can use any kind of composite, but again, I like the Floating because the Floating you can put out just a little bit, wipe it with some resin liquid, and then cure it, and you'll see it's a nice ball. Try to keep it as close to the bracket as you can. If you get it out in this area past the tooth, they're going to play with it with their tongue. Also on the initial wire, because I'm not sure how good your bond strength is back on the 5s and 6s, you might want to consider just putting a straight segment of the of the speed tubular cable wire. I will take a section and just cut it off the end, put a crimp on one end, put some composite, and then measure it across the back of the brackets and do that. And I can do a straight segment 3 to 3 and not lose any arch form, and that might be easiest for the patient, and you'll be amazed at the movement. I've sent you two of them in case you mess up, which you Connecticut Yankees quite often do. But also, I want you to try it on one of your labial cases that has a lot of crowding anteriorly, and like I say, you can go 6 to 6 with this wire, or if you want to just do 3 to 3 or just a short section. And I save the pieces because I find all kinds of ways to use them later. After the initial alignment, if you want to go back further to the posterior segment, I've included a 13 nitinol from G&H, and I've also included a 16 nitinol from G&H. This is the large arch form size. When I tried it on your models, they may be a little small, so you can take the mushroom shape and change it with a 3-prong plier, or even a bird beak, and like Dr. Rowett has said, you can distort nitinol, you just have to overdo it, so I'll do that. I've also used some 012 and 014 stainless steel that I had left over from an old partner, and those are easy to bend. I would not bend a 16 stainless steel. I don't think we can do that with the right tolerances. At that point, you probably ought to be in SureSmile wires. If you have any problems, call me. I'm nearby. It's easy. I know it's going to be a little nerve-wracking, so I would do this on a day or at least a time when you're not seeing other patients, because everybody's going to think this is just great. The brackets that I've used are a GAC lingual, which I'll show you in just a minute.